Content. Asanas as preventive measures. Obesity, procedure, benefits and contraindications for Vajrasana, Hastasana, Trikonasana, Ardha Matsyendrasana. Diabetes, procedure, benefits and contraindications for Bhujangasana, Paschimottanasana, Pavan Muktasana, Ardha Matsyendrasana. Asthma, procedure, benefits and contraindications for Sukhasana, Chakrasana, Gomukhasana, Parvatsana, Bhujangasana, Paschimottanasana, Matsyasana. Hypertension, Tadasana, Vajrasana, Pavan Muktasana, Ardha Chakrasana, Bhujangasana, Sharsana. Asana as preventive measures. According to Patanjali, asana means sthiram sukham asanamai, that position which is comfortable and steady. Asanas as a preventive measure are useful in many ways such as improves mental health, prevent bone-related diseases, dealing with obesity and diabetes, improves flexibility and coordination, removes stress and anxiety. Yoga. Oldest Indian way of dealing with the fitness, physical, mental, of human body, mind and spirit. Origin from Sanskrit word used to means unite, join. Founder of yoga, Patanjali Rishi. In India, sadhus, saints, practiced yoga thousands of years ago. Yoga is a science which deals with the health of body and harmony of mind. Ultimate aim of yoga, self-identification and self-perfection, which comes through self-purification and self-realization. Definition. According to Bhagavad Gita, yoga is defined as Samantvam yoga uchayate. It means yoga is balance and harmony of the mind and body. Ashtanga yoga, the ability to sit for extended periods as one of the 8 limbs of his system. Asanas. To sit in a comfortable position posture for everlasting period of time is called asana. It helps in cultivating awareness, relaxation and concentration. Patanjali, asana as to be seated in position that is firm but relaxed. Asanas can be preventive measures as they provide physiological benefits, helps in avoiding various lifestyle diseases. Benefits for bones and joints. Blood circulation becomes normal. Immune system becomes strong. Benefits for respiratory organs. Efficiency of excretory system enhances. Benefits for muscles. Obesity, it is a condition of excess body weight and fat. A person is said to be obese when his body weight is more above ideal body weight. Causes: heredity, sedentary lifestyle, endocrine gland functioning, eating habits. Asana, Vajrasana, Hastasana, Trikonasana, Ardha Matsyendrasana. Diabetes, most common lifestyle disease. It is a disease in which blood glucose in blood sugar levels are too high. Causes: eating rich carbohydrate food, not maintaining weight, bad eating habits, sedentary lifestyle. Asana, Bhujangasana, Paschimottanasana, Pavan Muktasana, Ardha Matsyendrasana. Asthma, common long-term inflammatory disease. It is a chronic disease involving the airways in the lungs. These airways allow air to come in and out of the lungs. Causes: gastroesophageal reflux disease, respiratory infection, airborne substance. Asana, Sukhasana, Chakrasana, Gomukhasana, Parvatsana, Bhujangasana, Paschimottanasana, Matsyasana. Hypertension means the increase in blood pressure due to bad lifestyle habits. Normal BP, 120 by 80 mmHg. Hypertension beyond 140 by 90 mmHg causes genetic, various diseases, poor lifestyle, lack of exercise and sports activities. Asana, Tadasana, Vajrasana, Pavan Muktasana, Ardha Chakrasana, Bhujangasana, Sharsana. Obesity. Obesity is that condition of the body in which the amount of fat increases to extreme levels. The condition when an individual weighs 20% more than the ideal weight. Obesity has become a universal problem. Obese people are always prone to several potential diseases such as arthritis, flat foot, diabetes, liver problem, hypertension. Obesity can be caused by the following factors: genetics, overeating, frequency of eating, physical inactivity, psychological factors, etc. Vajrasana pose, also known as diamond pose, pelvic pose, thunderbolt pose, kneeling pose, adamantine pose. To words I, Vajra means diamond or thunderbolt, and asana means seat. This is a pose which forms the base of many other asana. When can you perform this pose asana? Any time of the day, but best to do just after having food. Vajrasana is the pose in which many asanas are done. Contradictions: if you feel an intense pain in your feet, you can use a cushion. If you have had some leg injury, please do not do this without expert guidance. If suffering from any joint pain, spinal column problem, should not perform. Benefits of doing Vajrasana. It helps in digestion. Sitting in this pose helps in reduction of the hips. It helps in getting rid of constipation. It helps to fight stomach disorder. A few minutes of Vajrasana and you can feel the mind calming. Thus helps you in relaxing. It helps in increasing the blood circulation in the body. Yoga always helps in weight loss. So does Vajrasana. It helps in curing urinary problem. It helps in making the lower body flexible. It also helps in combating acidity. It helps in strengthening the sexual organs. It helps in toning of body muscles like the hips, thighs and the calf muscles. It helps in curing various body ailments like varicose veins and joint pains. This pose is a magic pose for people suffering from arthritis as it acts as a painkiller. Steps to perform: sit on the floor on a mat or directly on the ground. Fold your legs and sit in such a manner such that your heel touches your butt. Place your hands on your lap exactly as shown in the figure above. You may let your palms face the sky as well. Hold the sitting pose for 2 minutes to start with. You will feel a stinging pain in your feet if you are not habituated to sitting this way. You can stretch your legs and rest for a while and start again. Don't give up. Sit for a minimum of 2 minutes. You should increase the minutes over time. It is even possible to sit on Vajrasana pose for almost half an hour. Tadasana, palm tree pose. Tadasana, Tada is equal to mountain. Called as mother of all asanas because Tadasana is like the base from which all the poses emerge. Contraindications: weak leg muscles will not help in standing pose. Locking the knee can be challenging for long periods. Avoid putting strain on spine by carrying entire body weight. Do not practice it if you suffer from insomnia. People with headache problems should not practice mountain pose. Don't do it if your blood pressure is low. If pose held too long, as the blood may begin to pool in the lower half of the body, causing dizziness. Tadasana in pregnancy. Keep feet hip distance or wider apart. Steps to perform. Stand straight on a mat with the trunk pulled upwards. Breathe in and raise your toes gently and try to balance your body on your heels. Stretch your shoulders, arms and chest upwards while your toes bear your body weight. Feel the stretch in your body from the head to the feet. Hold this pose for about 5 to 10 seconds and then gently exhale. Benefits of Urdhva Hastasana: one of the best yoga poses for increasing height. Reduces obesity of body, improves digestion, raises the stature. Improves body posture and balance. Strengthens your ankles, knees, thighs, arms and legs. Taking cold water bath every day and doing this asana afterwards serves to cleanse the bowels. Trikon Asana, triangle pose. Trikona means three angels and asana means pose in Sanskrit. This asana look like the triangle shape, so it is called as Trikonsana. This asana stretches the muscles and improve the functions of the body. This is a good exercise for pregnant women. Contraindications and cautions: low or high blood pressure patients should not practice Trikonsana. Those suffering from back and spinal injuries should not perform Trikonsana. Practice under expert guidance and consult a doctor before practice asana. Especially pregnant women if there are any complications. Duration: repeat 3 to 5 times from both sides. Steps to perform. First, to stand by keeping distance between 2 feet as shown in the above image. Now turn your right leg at around 90 degrees as shown in Fig. While inhaling, raise the both hands in the upward direction in such a way that they will be parallel to the ground and palms facing downwards. Now bend at right side while exhaling and your left hand facing towards the ceiling and right hand touching your right toe as shown in Fig. Keep your eyes facing towards the ceiling, towards the left palm, and do not bend forward or backward. Pregnant women should take care of her balance. You can take support of a wall or your friend to maintain the balance. Keep inhaling deeply and while exhaling relax the body more and more. Stay for 1 to 2 minutes in this posture. Now inhale and get back to original position. Repeat from bending left side then the right side. Benefits: stimulate and improve the function of blood through the entire body. Strengthens and stretches the hips, back, arms, thighs and leg. Reduces blood pressure, stress and anxiety. Cure indigestion. Gives flexibility to trunk, hamstrings and hips. Transactional: calm the mind. Stimulate the function of kidney. Helps to remove fats from the waist and thighs. This asana improves the balance and increases concentration. Bhujang Asana Cobra Pose. Bhujangasana is an excellent exercise for those suffering from a stomach disorder, spinal cord problem, back pain, respiratory disorder, and obesity, weight gain. Contraindications. Pregnant women, a lot of pressure on lower abdomen. People suffering from ulcer, heart problem or any surgeries like spine, brain or lungs, neck problems relating to spondylitis should not do this asana or take proper guidance. Asthma patient should practice first pranayam before attempting this pose or shall avoid. Avoid practicing during periods if you feel uncomfortable. Steps to perform. Lie down on your stomach and feel relaxed. Stretch and joint the legs so that knees of both the leg touches each other. Place the palm near the chest facing the ground. Keep in mind that elbow should be straight. Take a deep breath and lift your upper body like head, neck, shoulders, chest upwards as shown in the above image. In this position your all weights of the upper body will come on your hands and thighs. In Bhujangasana your inhaling and exhaling plays an important role. So now try to move your head back as much as you can. Stretch as much as you can but don't overdo or overstrain. Hold your breath for some time in this position. Now exhale slowly and bring your stomach, chest, shoulder and head to the ground. Repeat this cycle for 4 to 5 times daily. Benefits: it cures acidity, indigestion and constipation. Improves the function of liver, kidney, pancreas and gallbladder. It cures back pain, spondylitis, slip disc. It strengthens the arms and shoulders. Helps to lose weight. Helps to improve blood circulation. It expands chest. Effective in uterine disorder. Improves the function of reproductive organ. Brings flexibility in upper and middle back. Relax the body muscle and give strength to spinal cord. Releases stress and fatigue. Useful for those suffering from respiratory disorders such as asthma. Diabetes. Diabetes mellitus is a disease that causes sugar to build up in our blood. Our body uses hormone called insulin to control the level of sugar in our blood. When the body fails to produce sufficient amount of insulin or when insulin does not work properly, diabetes occurs. This disease is also known as blood sugar, is characterized by hypoglycemia, high blood sugar level. Glucosuria, glucose in the urine, polydipsia, excessive thirst, polyphagia, excessive appetite symptoms, tiredness, blurred vision, poor immunity, excessive weight or weight loss, etc. Types of diabetes. There are three main types of diabetes. Type L, insulin dependent, the pancreas gland does not produce insulin. Type 2, insulin independent, normally appears after the age of 40 in which cells fail to respond to insulin properly. Type 3, gestational diabetes, it occurs when a pregnant woman without a history of diabetes suddenly develop a high blood sugar level. Paschimottanasana, forward bend pose. Paschim means your back and Utthana means stretching. This asana covers the stretching of the whole body from head to heels, so it is called as Paschimottanasana. Contraindications for seated forward bend pose. Pregnant women should not practice Paschimottanasana. Person suffering from slip disc or sciatica problem, asthma should avoid Paschimottanasana. Steps to PRFORMLS, a patient should not practice. Sit down straight with your legs together by stretching in front of you. Keep your head, neck and spine erect. Place the palms on your respective knees. Now bend your head and trunk slowly forward to catch the toes with the thumb, index and middle fingers without bending knees. Take a deep breath and exhale slowly. Try to touch your head to your both knees as shown in above image. Bend the arm and try to touch the elbow on the floor. Exhale completely and holding out your breath, stay in this posture for a few seconds. After few seconds, slowly return to your starting position. Breathe normally. Repeat this for 3 to 4 times. Benefits: it acts as a stress reliever. Reduces fatty deposits in the abdomen. Remove anxiety, anger and irritability. Calms the mind. Stretches the spine and brings flexibility. Good for constipation and digestive disorder. Useful for increasing height. A practitioner of this asana can live a longer life. Tones the abdominal pelvic organs. Balance the menstrual cycles. This asana is recommended especially for women after delivery. Pavna Muktasana, wind removing pose. Pavna means wind and Mukt means removal, therefore wind removing pose. It is beneficial to cure gas problems and poor digestion. Regular practice of Pavan Muktasana help to stimulate bowel movement, which is very necessary for removing waste material. Contraindications. Those suffering for high blood pressure, slip disc, ulcer or severe back pain should not do this asana. In pregnancy and menstruation, women should not practice this. Steps to perform. Lie flat on your back and keep the legs straight and relax breath deeply and rhythmically. Inhale slowly and lift the legs and bend in the knee. Bring upwards to the chest till your thigh touches to stomach. Hug your knees in place and lock your fingers. Try to touch the knee with your nose tip. This is not easy in first time. But regular practice you can do this. Hold this position for 20 to 30 seconds. You can extend it till 1 minute as per your capability. Now exhale slowly and come back to the original position, that is Shavasana, lie straight. This is very beneficial for stomach abs. The results are very impressive. Practice 3 to 5 cycles each day. Benefits: Pavnamuktasana cures acidity, indigestion, and constipation. It takes out very quickly the wind present in belly. Pavnamuktasana is very good for all abdominal organs. Regular practice: Pavnamuktasana cures gastrointestinal problems. Helpful for those suffering from gas problems, acidity, arthritis pain, heart problems, and waist pain. Strengthens back muscle and cures back pain. It gives flat stomach. Everyone should practice this asana for flat stomach. Very beneficial for reproductive organ and for menstruation disorder. Steps to perform Ardhamatsyendrasana. Kneel down with your legs together, resting on your heels. Then sit to the right of your feet as illustrated below. Lift your left leg over your right, placing the foot against the outside of the right knee. Bring your right heel in close to your buttocks. Keep the spine erect. Stretch your arms out to the sides at shoulder level and twist around to the left. Now bring the right arm down on the outside of the left knee and hold the left foot in the right hand, placing your left hand on the floor behind you. Exhaling, twist as far as possible to the left. Look over the left shoulder.